Snoring is a major problem worldwide. Many millions of people are suffering with this problem. Snoring, as well as obstructive sleep apnea, go hand in hand. Today I'm going to show you some great exercises that's going to strengthen those muscles in the oropharyngeal region that's back in the throat. During sleep, the space behind our tongue narrows, and the tissues around it become floppy and relaxed. When air gets forced through those areas, as we breathe in and out, the tissue flutters, making noise like a flag whipping in the wind. And snoring happens when the airflow from the breathing causes the floppy tissue in the back of the throat to vibrate. But these floppy muscles in the back of the throat can sometimes even close off. And that can totally obstruct the airway that we call obstructive sleep apnea. And many people who are suffering with sleep apnea use a CPAP machine. Even though this will not cure the condition, this does help the body get more oxygen into those lungs. So here is our goal, to strengthen these oropharyngeal muscles, that these floppy and vibratory tissues in the back of the throat will then be more supportive, so you will not continue to have that obstruction. So are you ready? I'm going to share many different exercises that you can start doing on a regular basis. You can choose several of these exercises, and you're going to do each exercise anywhere from 30 seconds to a minute. The first one is just saying the vowels, A-E-I-O-U, but you want to stretch it out, A-E-I-O-U. Put your fingers underneath your throat, back in here, and feel the muscles contract, A-E-I-O-U. You can sing that in the morning in the shower, and you can also change the pitch or the tone when you say it, like A-E-I-O-U. The muscles will contract differently. That's a great exercise, and you can do that randomly. So now I want you to take your tongue and put it behind the back of your teeth and push it back against your hard palate, against the upper roof of your mouth. Slide it back and do that about 5 to 10 times. Let's do one together. Put it behind the back of the upper teeth and push it up against the hard palate and push it back. Let's go. Let's do one more. Take your fingers, put it underneath your throat, and feel those muscles contract. Let's go. Beautiful. Now let's take the tongue and push it straight up against the hard palate. As you push up, you'll hold it about 10 seconds. You'll do 5 repetitions. Let's do one together. Put your fingers underneath your throat, back in here, and feel those muscles contract. Take your tongue, push it straight up. Let's go. 10 seconds. Beautiful. Feel those muscles contract. Keep pushing up. Excellent. Now take your tongue, instead of pushing up, let's push down for 10 seconds against the lower floor of your mouth, the soft palate. As you push down, you'll feel different muscles contract and work. Let's go. Keep pushing down. Feel those muscles contract back in the throat region. Good. And you'll do 5 repetitions of those as well. So this exercise, we're going to stabilize the airway to help our breathing. You're going to breathe in through your nose. When we exhale, you're going to breathe out of one nostril. You're going to inhale again, and you're going to switch to the other side and breathe out of the other nostril. You'll do that about 15 to 20 times. Let's do one on both sides. You breathe in, hold one nostril, breathe out of the other. Breathe in, hold the other nostril, breathe out. Good. You may notice that one side is more clogged than the other, although continue to do your best. When you were younger, I know you did this. You take your tongue against the top of your roof of the palate and you go. That is an amazing exercise for the back of your throat, the tongue, and those muscles. You're going to do those for about 60 seconds, but let's just do it for a few seconds together. And while doing so, when you feel underneath your throat, you're going to feel those muscles really clamp down and contract. Now this next exercise is powerful. It's contracting the uvula. That's the little flap that hangs down in the back of the throat. If you look in the mirror and you open your mouth and you just, like you're gagging but you're not, you can see the uvula move up and down. You're going to do that for like 30 to 45 seconds. Now I want you to keep your mouth slightly open, and you're going to push your jaw to the left, hold it about 30 seconds, then push it back to the right, hold it 30 seconds. You'll do about a total of 6 of those, 3 on each side. So this is what it will look like. 30 seconds, and then you go the other way. That's great for the jaw, the facial muscles, as well as the TMJ. Now, I'm sure that most of us love to sing something, either in the shower, to the music. Sing. If you're a snorer and you have problems with that sleep apnea, one of the greatest things you can do is start singing because you're utilizing those muscles. So just sing along whenever you want, and that can be a great asset for you. Now take your tongue and make a taco out of it. You know when you stick it out and you squeeze it together like this? Well, squeeze it together as much as you can and push it out as far as you can. Hold it there for 10 seconds and do that for about 30 seconds. Then take your tongue and then push it up as if you were trying to touch your nose, which I can't do, but you'll hold it out as far as you can, trying to touch your nose, hold it for 10 seconds, and do that for about 3 times or so as well. Now take your tongue and push it to the left of your mouth like this, and keep pushing, 10 seconds. Then you'll go back to the right, 10 seconds. Make sure you stick it out as far as you can as you push over. You'll do each side about 5 repetitions. Now, pound for pound, our tongue is probably one of the strongest muscles of our body pertaining to size. So what I want you to do now is get a spoon. And I want you to put the spoon in front of your lips. You're going to stick your tongue out. You're going to push the tongue out into the spoon as you resist it. And you'll hold it about 10 seconds. And you'll do it 6 times for about a minute. This is what it will look like. You stick it out like this. Just keep pushing as you resist, as you push back with the spoon like this. You'll hold that about 10 seconds. You can take a break for a couple seconds and do it 6 times. You will feel tremendous changes. You'll feel all back in the throat, those muscles that are kicking in that you've never utilized before. Well, you've done a great job. Now, I ask you to practice these every single day, and you will see within a few weeks tremendous changes. Now that you're going to do these exercises regularly, there's a few things I want you to understand. If you're overweight, please start losing your weight. I guarantee that for the majority of you, you will see a tremendous change because as you lose weight throughout your body, you will be losing excessive fat within a tissue that's potentially obstructing your airway. You must go on an anti-inflammatory diet. Get rid of the sugars. Eat natural whole sugars, fruits, with the fiber. Drink lots of water. Start to exercise. Exercise is a tremendous asset. It may be walking, riding a bike, swimming, whatever you do when it comes to helping these conditions. When you sleep, make sure you're not eating at least 2 to 3 hours before you go to bed. Do not sleep on your back if all possible, and if you do, make sure you're on an incline. That will help you tremendously. And sleep on your left side rather than your right, because sleeping on your left side will help digestion within your stomach and prevent any reflux, which potentially can cause problems in the back of your throat. So, please start practicing these exercises daily. Share this video with your friends and family because you'll be doing them a great deed. Leave your comments below because I know there'll be many. And most important, make it a great day. I'm Dr. Alan Mandel.